Hello, and welcome to this interview with Scot Newton. For 2018, we're looking at various case series. So, one of the things which we thought from Harley Street Physio was to look at real patient series, looking at common problems and also looking into the solution. So, it's great to join Scot Newton, who is my friend and also a very keen distance runner. He's a specialist on running injuries, works with multiple locations from London. So check him out on www.londonrunningphysio.com. So one of the things which we see frequently at this time of the year is stress fractures. And both for a clinician as well as from a patient, it's early identification of these injuries is really important. So I had a brief chat. He wrote a blog on his website called What I've Learned from Stress Fractures, which I'll put on the show notes below. So do check it out. So it is his experiences on dealing with the stress fractures and also how to manage them. And let's go straight to the interview.
It's great to catch up with Scott. We worked together in Croydon, and thought like it'd be good to have a little chat. I read your blog recently about the sacral stress fractures.
Yeah.
So I thought, I was in the city, just catch up on that, which I think it's really relevant now because I think you must be seeing a lot of runners already training for the
spring marathons. Yeah, London particularly.
And normally we see a bit of spike in stress fractures usually around the January February time. So just for the listeners, could you explain, introduce yourself?
Hi there, my name is Scot Newton. I'm a keen marathon runner. Got a PB of 2:37, which I guess like every other marathon runner, I'm keen to see if I can whistle down. Maybe I've got an extra two minutes in me on the right day, but we'll see. I'm a physiotherapist. I've been qualified since 2005. Worked in the NHS for a number of years, most recently as a extended scope practitioner alongside Benoy, and I now work full-time in private practice as of June this year, so in the city. So we're here at the Running Works, right stone's throw from the Gherkin, really.
Yeah. Just checking out, like you've got a fantastic setup here, while walked in. So is this something you've been involved for a while?
So yeah, we've been involved in the Running Works or the Run Faster sports clinic for the last couple of years, just over, and I also work at another clinic just around the corner with Complete Physio, which is a much larger clinic as well. So.
And I believe a lot of your clientele are runners,
Yeah, absolutely. So yeah, my I guess my clinical sort of passion is really trying to look after runners and.
Yeah. So the key thing was obviously the injury, which I read on your blog. So could you just give, you never had a major injuries during your 17 years of running. So how that led to your injury? So could you give a synopsis of what happened?
Yeah, absolutely. So yeah, this year in April, I sustained a grade 4 sacral stress fracture. So that's the sort of the little triangular wedge of bone that sits at the bottom of your spine, and it was essentially from, I guess, running too much in simple terms, and I guess like everyone else, when you start to do the sort of post-injury or the post-mortem after an injury and looking at what are the causes, was an obvious spike in training load, volume, increase in intensity. There certainly wasn't anything across the board there.
So what were your symptoms initially? Like obviously we're training for something. When did you start noticing your symptoms?
So I can really chart that over the course of 3 days. So on a Monday, I did my usual commute run. I think to and from work. Had a very, very slight sort of ache in my right sort of upper glute, which really just felt a little bit like a little bit of muscle soreness. Nothing sharp, nothing untoward. I ran on Tuesday. I think it was, I don't know, maybe only 5k or something like that, and felt absolutely fine. And then Wednesday, for my usual sort of midweek, sort of medium long run, I was, I think, 6k in, and sort of the ache came back, and then that built in intensity. And by the time that I got back, once I sort of stopped and then sort of started to walk around, I had sort of quite quite acute pain really. So each footstep had quite sharp pain on the right hand side. Of sort of.
So you're a physio as well as a runner. So what were your thoughts initially? What do you think? You feel it was a muscle thing or what?
I think subconsciously I knew it was more than a muscle thing and so on, but I think I was probably guilty of trying to maybe treat myself or ask colleagues to sort of have a quick look, and have some treatments. Like I've had a little bit of sort of myofascial release and things like that unsurprisingly didn't help. And I think the long story short, a week on, I was no better. I started to really put two and two together with focal pain, weight bearing, no sort of symptoms.
So you were not able to run at the time?
Not at all.
Not at all.
No, I couldn't walk without pain.
And so how much were you training in an average week? What's your weekly mileage at the time?
Weekly mileage at the time, I think from recall, I think it wasn't huge, and I think we all have our relative that wasn't huge, or it was, but I was running. It's probably in the region of about 80 kilometers a week, something like that, so yeah, that was running most days, and I'm pretty sure I was doing double days on a Monday and a Thursday at that time. I think maybe getting back to why do I think I ended up with a stress fracture? I think at that time in April I had what would have been a 2-month-old daughter. So I think I doggedly tried to just continue sort of my usual running frequency and volume despite the sort of birth of my daughter. And I guess anyone knows that sleep suffers massively. Yeah.
So how much were you getting on average sleep at the time?
So I think probably around that time it was probably around 4 hours. Sort of broken bits of sleep.
So you normally sleep like 7 hours or something?
I normally sleep sort of 6.5, 7 hours. Yeah.
So it's a big drop in there. So was that the only change which you could? You didn't have any spike in training or any change of shoes or technique or anything?
No, nothing. I think if anything, I'd dropped a little bit of intensity where I wasn't sort of going to a track on a Tuesday night just for the logistical reasons of it not being okay to come home at 10:30 in the evening and things like that.
So you didn't run for about 3 months. So that's a long period for a seasoned runner like you. So how did that affect you mentally? And it must have been quite tough.
It was hideous. Yeah, absolutely. Yeah. So I think I suppose it gave me a good dose of empathy with the runners that I treated. Really understood the frustration of not being able to run. I guess the positive side of that is that I got a little bit more sort of first-hand experience of sort of cross-training programs and working on sort of spin or turbo sessions on the bike to try and maintain fitness. And
so how did you make, when you have a long gap, one of the mistakes people do is to rush it back, so you had it for such a long period. So how did you make that transition after a long layoff back to running?
Well, I guess it started, I had a sort of a check MRI early July that showed satisfactory healing, so at that point it was just sort of, I guess, gradually building that up. And I guess what did that look like for me? So where I started off with trying to follow just a really simple principle of kind of sticking to basically a rule of 3 where I sort of complete 3 runs initially and then sort of cut into about two runs where I started off at 10 minutes. Had a day of rest between, checked that nothing flared up, and then did exactly the same again, and then the same again, just to check that things were happy. There were a couple of times definitely initially where whether it was me being a little bit hyper vigilant or overly assume where I thought, can I feel a little bit of something, and I sort of added an extra day where just wanted to make sure I wasn't rushing things. So I think it was about a month all in all before I sort of up to running 30 minutes or so, and it was more like sort of 2 months before I did any sort of consecutive day training.
And I think sometimes injuries you learn more about your body, and you go back differently. So there's some positives. So being a major injury, how has it changed you as a runner in your training philosophies and your routines? Have you?
I think it's I think it's made me sort of certainly more aware of when I'm feeling fatigued, to sort of be able to say, well, actually, let's listen to the body a little bit more. If I've got a hard session planned one day, my daughter's had an awful night's sleep, which still happens. Can I juggle that around, or even sort of take it out for a week? And I think I've kind of become a little bit more flexible in sort of adjusting sessions there. I think the other thing is just realising how important sort of strength and conditioning work is. So I suppose that's probably the only other thing other than sleep where I say maybe that's the thing that slipped a little bit. So it's something I've been traditionally quite sort of good at, where I do at least 2 decent strength sessions a week, and that's probably the thing that I'd become maybe a little bit inconsistent about with when time became a little bit more of a more rationed, I suppose.
I think with training with runners, there's different philosophies. Way I look at it is I usually keep my runners with 3 days and 2 days of strength and conditioning, which seems to be a good balance. How do you do that with your clients, with runners? How do you keep that balance between running and strength and conditioning and recovery? Because it's can be difficult when you're working like 40-50 hours.
Really difficult. I think it also depends on the runner as well. I mean, it's kind of obvious, but
But a recreational runner, 10k plus.
So recreational runners where they're not running sort of every day, they're not into double day training and that sort of thing. That are probably sit absolutely alongside you. If they can be doing at least a couple of decent strength sessions a week, and then sort of fitting the runs around that, then
and cross training. Definitely.
Cross training. I think there's certainly value there that they can get the physiological sort of stress, work cardiovascularly without sort of the mechanical sort of load. So I think that's valuable. I think perhaps it becomes a little bit more challenging where you get into the more sort of serious sort of club runner and elite guys where.
And for the performance, when the performance comes in, they want to do like a sub 3 marathon or something like that. You need to put the mileage in, isn't it?
Yeah, and there is no way getting around that. So.
You still have to run a lot to get that.
So so I think there are things like looking at the acute chronic workload ratios. It does have a bit of a guiding principle. So that's something I've written a little blog about. So I won't sort of bore people with that now. But,
so finally, I think it'd be good to finish off just a few thinking of stress fractures, because that can be quite difficult with your runners to pick up. So from your experience, extensive experience with runners, how do you pick this? Is there any set pattern, or is it just your feeling, or what are the things makes you be suspicious of a stress fracture in a runner, for example, with the tibial pain or a hip pain, because it could appear very muscular. So what's your thinking process in that?
I think clinical reasoning in picking this up is really key. And I guess we can look at sort of the intrinsic and extrinsic risk factors. So I guess examples of the intrinsic side are sort of gender, BMI,
female, we know that. Previous history.
Those sorts of things. Then the extrinsic factors, I think, perhaps I think very significant. So sort of recent change in training. So I guess increase in mileage. And I think it's also important as well to chase people for. So they might be coming in with a problem that they get running. So get a snapshot of their whole exercise week.
What else they're doing? They're doing the.
So I've seen quite a few people. I've seen quite a few people. I can think of a calcaneal stress fracture that came from the introduction of HIIT training rather than increasing the running, and also it seems. And I think just listening to that history. So it's a sort of pain that gets worse. With more activity, whereas a lot of muscular or tendon pains tend to warm up and get a bit better. Sort of pain on sort of high impact. So particularly I think simple clinical tests. Maybe can sort of hop on a limb without sort of localized pain. And things like that. So
unfortunately, a lot of these cases, when you do an X-ray, it'll come back as normal. So that can give a false reassurance. So many times they've been to the GP, and I think it's important we have access to the MRI and things like that. So what's your view on that? Do you sort of fast track them to your colleagues for possibly MRIs, to your doctor's colleagues and what do you do in that case?
That's a great point, really. So I think sometimes people can be falsely reassured and continue to have this sort of seemingly mystery pain. I can think of that in the instance some sort of femoral neck stress fractures and so on. But I think essentially, if you have a high nexus of suspicion, someone that's maybe sort of coming to you having seen a couple of other people, they've had, quite often they've had a lot of soft tissue work and they get some transient relief and a bit of rest, but as soon as they go back to sort of impact running based activity, symptoms are back. Then I think we have that duty of care really to kind of flag that up, and particularly in endurance athletes, runners. I'm lucky to work with some very, very good sports docs. Kath Spencer-Smith is someone I think that you also work with. Who's
I had a couple of hips where I sent to Kath, where she picked up quite at the early stages. So I think I totally agree with you. It's having the sort of trusted clinicians who you can send for a second opinion. They're going to take it further. So it's I definitely feel like if anything with hips or runnings, I definitely look into sending for Kath for a second opinion.
Absolutely. I think that's that.
It's having the network there, isn't it?
It's having a network, and I think just learning sometimes to step back and look at the whole picture of things.
And finally, for runners, people are going to spike up their training. It's bound to happen. So what would be your top tips to prevent stress fractures in, for example, somebody preparing for the London Marathon next year? What would you say would be the key ones to do?
So I think sometimes basic principles are really good, actually. So particularly for sort of first time marathoners, to think about trying to follow maybe the sort of 10% per week progression rule when it comes to volume. That's actually quite a nice, simple, pretty sort of
people can understand it quite simply.
With that.
So have a graded increase in training with 5 to 10%.
Graded increase in training. Think about rest and recovery, where that fits into your training as well. So it might be actually that you do need to sort of give up or prioritise out some of the other activity. If you've always been a keen swimmer or gym goer with other things, then it might be that you're having to sort of...
And look at the training as a whole, not just put running as a separate entity.
So I think, a gradual increase in training. I'm a big advocate for getting a decent coach on board, because I think...
or a good plan, sometimes you see people come with the running program, which is running 7 days a week, 6 days a week, which is not sustainable,
certainly not entry sort of, or first time marathoners.
What would be your sort of good? Would you encourage like 4 days or 5 days? Because people come with different programs. For a novice runner who has done multiple 10Ks and doing the first marathon, how many days of running do you think is sort of is reasonable? They're not looking at a PB here. They're just looking at a decent,
I think they need to be running at least 3 days a week, probably 4 days.
So 3 to 4 is a good sweet spot.
3 to 4 days allows a couple of days where you can do some strength work, and a day where you just give yourself some rest. Sensible increase in training. Do some strength work.
Massive.
All of us, hands
big
up
fan
as well.
of that.
So I think that's
and you don't need more than twice a week if you have a good program. Working on the big groups.
You don't
need
absolutely. And
so what are your go-to exercises for your runners which you use in your strength, which is the ones you give out pretty much most of the time?
So I think things that target sort of the main muscle groups. So could be something like a simple goblet squats, or less technical leg press, knee extensions,
deadlift patterns. Standard ones.
So pretty standard, to be honest. But just to get some basic sort of capacity and resilience built in there. I think maybe as a third thing is just, if you do have any sort of niggles, or even if you're having a really bad week at work, at home, and you're just tired, maybe you've got a cold, it's fine to back off from the plan. So I think don't hold yourself hostage to a plan. And actually just think, right, okay, I'm just going to have to see the bigger picture. 1 week in the 12-week block that isn't ideal. It was not going to have a big detrimental impact. But if you push through and end up injured and have 3 or 4 weeks of very disrupted training and so on, then that was going to have a much greater detrimental impact.
And finally, if you can't train, it stops you. Seek help if you feel like you're not able to go forward. Sometimes people push
Yeah.
and they come to me with a full-blown fracture where we can't do much at all, you know. So
Yeah.
seeking help, if you think.
Seek help early. So yeah, I think if you're going out, you know, maybe it's the third time, the second time, third time you've felt the same pain that's come on, and so try and nip it in the bud.
But
seek help sooner than later.
Yeah. You don't have to come for every ache and pains because the runners, you know,
Yeah, exactly.
good at training, but
if
if it's
it's a
consistent.
persistent thing that's been there 2 or 3 times, then I think that's certainly worth getting it checked out. Yeah.
So great, Scott. You know, that's really useful. You know, putting from the hat of a physio as well as a runner. Just for listeners, could you? Which is the best place for you know, people to be into contact with you?
Probably my website actually, which is www.londonrunningphysio.com. So yeah, have a look there.
And you write quite a few blogs and, you know,
right, a few blogs. I could be better at keeping them sort of up to date. But yeah, there are 2 or 3 ones that I think are particularly interesting. So yeah.
Any marathons for next year? You're training any?
Yeah, hopefully. So yeah, I'm sort of in base training for a spring marathon, which I think will be Rotterdam.
Okay.
However, I've got a good friend who wants to have a running stag do in Chamonix just before that, so I'm thinking I might have to put Rotterdam off and maybe go for London or somewhere like Copenhagen a little bit later, April or early May.
So quite a few things planned up there.
Yeah, so hopefully.
Okay, thank you.
Great, thanks, by the way.
Hope you guys found the interview useful, and there's some good points there looking into various risk factors, the training load, recovery, and if in any doubt, it's always good to check with a physio who has special interest in running injuries. So do check Scott at londonrunningphysio.com. And at Harley Street Physio, we also a specialist center for lower limb, mainly dealing with running injuries and specialist hip and groin. So till the next series, see you guys.